8 million people are living with HIV in South Africa, and approximately 6.2 million are on antiretroviral treatment. These figures were released earlier this year by the Tembisa model. As the world commemorates World AIDS Day today, we'll look back at the progress made in medical research to understand the disease and increase life expectancy of those living with the disease. South African National AIDS Council CEO Dr. Thembisile Xulu joins us now for just a little bit more with this and the numbers. Doctor, this is an epidemic South Africa's faced for really decades now. But we're still sitting with a situation where 8 million people are living with HIV, 6.2 still on antiretroviral treatment. What would you say to these numbers, considering the fight that we had been raging against HIV and AIDS for such a long time in the country?
Good morning, Arabile, and you're absolutely correct. It's been 20 years since the government has been offering free antiretroviral therapy. But the truth of the matter that we see is that, for instance, when we experienced COVID, HIV sort of took a back seat, and we are still struggling to get people back on treatment. If you look at how we are measured as a country in terms of performance on treatment, it's what we call the 95, 95, 95. And the second 95 is the worry, which looks at the number of people started and staying on treatment. As you mentioned, only about 6.2 million people are on treatment, and we should have 8 million on treatment. And we are not there yet for multiple reasons. The situation around the funding in February didn't help because funding was pulled off. We lost some staff members, some community members that were funded to make sure that we bring people back onto care, back onto treatment, were also not funded. And complexities related to the funding, related to issues like stigma, are actually contributing to us not being able to get people back on treatment, but also to get them to stay on treatment.
Yeah, and I guess it becomes so tough now because then the question mark is, much like the UN AIDS has been warning, do you think a looming HIV crisis could then be on the horizon, or would it take a lot more to get to that stage?
When you look at a situation like South Africa, I think if you look at the strategies, maybe if I can mention 2 or 3 just in the past medium to short term. Okay, firstly, our HIV response is primarily funded by government. So our situation is a bit different from a sustainability perspective because we have a sustainable program funded by the fiscus. So 90% of our patients actually get their treatment funded by the Department of Finance or Treasury. Secondly, just 2 weeks ago in the Free State, the minister launched what we call the 6 multi-month dispensing. And this is meant to make sure that once a patient is stable on antiretroviral therapy treatment, they don't have to come to the clinic every month, Arabile, miss work, stand in long queues. You get your 6 months worth of medication, which means you only come to the clinics twice a year. That will make sure that people take their treatment on time. And when you are on treatment and your viral load is suppressed, then you don't transmit it not to your sexual contacts, but also not to an unborn baby during pregnancy, delivery, and during breastfeeding. The minister also launched the 1.1 million Close the Gap campaign, where we are now actively looking for the ones that are not on treatment. And our communities that we are working with, the PLHIV sector, are assisting with this to make sure that we bring people back onto care. So I think if there is solidarity and we are able to mobilize funds from the private sector, this is now globally, and globally, as much as there are other competing priorities, be it war, climate change, etc., we remember that health is also a human right and HIV is not outside the health agenda. We saw that during the Global Fund replenishment, where big countries did pledge money towards the 8th replenishment. Yeah. So if we continue to see that global solidarity plus a lot of domestic investment, we will be in a better place.
So on the funding aspect, we still need a lot more to come through with regards to that to aid the progress, don't we? Because, I mean, thus far, what has it been? Almost $1 billion, so 753 million rand, I think it was, in emergency funds to try and fill the gap. But it won't be enough.
Yes, definitely. So I think the government had requested about 1.4 billion from Treasury 753 went to the provinces. About 200 million went towards the CCMDD program. This is the courier program that sends medications to patients. And then another 153 million or so went to our researchers. More funds have then been applied for, but you are seeing that private partners are starting to come through, and the DG is leading a program through the DG Murray Trust, where our private sector is saying they are also wanting to put their hands up to contribute. That will yield some results, and we will speak about that. And just last week or 2 weeks ago, the Chinese government pledged $3.5 million towards South Africa's HIV program, mainly looking at key populations and people who inject drugs. The truth of the matter, Arabile, is that whatever the Americans put into the system will never be replaced dollar for dollar, and we need to be more creative and more efficient in how we use the money in order to plug the gaps. Therefore, an example I gave is rather than issuing 1 month worth of medication, give people 6 months, save them some money from coming to the clinics, but also save the nurses time so they focus on the sick patients.
People are also living longer with HIV, though. So that's the advancement of medicine and the like actually helping, as well as the treatment, showcasing the significance thereof. Am I right?
You are absolutely correct, Arabile. People are living longer from HIV, but what we are then seeing is that the more they age, they are then getting the non-communicable diseases. So they are starting to get hypertension, they are getting diabetes, people are suffering from mental health conditions. And for women